Hi there, I'm Patrick Fenner. I'm the co-founder and director at DefProc. We're a design engineering company, so we do proof of concept, prototype, small run production. We've built a lot of things over the sort of 10 years we've been running, things like remote river level sensors for the Environment Agency. We've built prototype medical devices that have then gone on to clinical trial. We've built silly things like foam dart range game that we've taken around to things for a bit of fun. But we've sort of ended up with a kind of an IoT speciality. We've done things like NB-IoT, we've done RPMA, and we've done LoRaWAN. Now, when we started looking at it, LoRaWAN was very much a new technology. We were in the original Things Network Kickstarter. We're the initiator for the Liverpool community and run more than a dozen gateways now. So we've been working on LoRaWAN for sort of 4 years now. We've been building with it, we've been teaching others, we've been using it to create solutions to problems that we have. One of those was push to talk. So push to talk is a service that's designed to help reduce social isolation. Each person has a button at the side of their phone. When they press the button, their phone rings and then they pick it up, and that lets them talk to somebody else who's also just pressed their button and just picked up their phone. So they can talk to each other for as long as they like about whatever they like, and then when they're finished, they hang up. They press the button again, they get another call. Now that came out of a social care hack day about 6 years ago or so. We won the competition on the day, and that gave us the opportunity to build a proof of concept device and test out that service. When we showed that would worked, we then took that forward and applied for funding to be able to run a slightly larger trial. So we built a set of physical buttons, Ethernet connected, power Ethernet, plug into the router, and off you go. So it was nice and easy to deploy. And then there was a set of elderly isolated people, so we were working with care organisations. And it was a really nice point there where we could take this idea that we'd had, an idea of what would work, and we could take it out of the lab, out of the workshop, and put it into people's homes and see how they actually responded to it, see what they got out of it, see how it worked for them. Did the service do what we expected? We got to sort of let it out in the world and see how other people responded to it. So that trial was successful. We put it out, we got out there, we got people on it, and we got calls on it. But the big thing we got was when we went to go out and give people buttons, Ethernet connected buttons, about 50% of the people that we were going to didn't have internet at home. So there was a massive cap on the deployment that we could actually make. That was really, really kind of limiting. And even the ones that did have it, most of those in that age range didn't actually know that they did. It was just a box in the corner. They had TV, they didn't know they got internet. So that was a real kind of, if you were going to go out and offer this to somebody, to put it in their home, and they don't have internet or they don't know they have internet, then they don't know that they can use it. And then that's, massive cap on what we can do. And its idea as an inclusive service of being able to join people together and let them talk suddenly wasn't valid. We know it works, but it wasn't as inclusive as it needed to be. The core of the technology was there, so we got like just a button and a phone, and it was as simple as possible. Everyone can understand to use it. Everyone's used a button, everybody's used a phone, no matter how old they are, everybody knows where that is. We'd even tried with deployment with care providers. So we're asking non-specialists to be able to go out, people whose core job and primary job absolutely should be the care of the people that they're looking after. And we asked them to be able to deploy a technical device in somebody's home, but we had that set up. We had it sorted. We didn't need anything more than the phone and the button, and that all worked. So that was great. But we still needed a way to have that button connect to the internet, to be able to forward us those button presses without needing a local connection. We could go for something like Wi-Fi, but you still need broadband. You still need that internet connection. It still needs to be there. Even something like Bluetooth. Again, that's a local point-to-point connection. You still need that route out to the internet, the place to go next. The only realistic thing that we had at the time was mobile data, to be able to add a cell modem to each device, put a SIM card on each device, and to be paying a monthly amount each device for each device. with the downside that we were going to have to pass on that expense to the service users. These people who are already elderly, already isolated, already didn't have the same technological advantages as anybody else. We'd have to pass that on to them, and we felt that that would make the service too expensive. But we were fortunate enough the other year to be a consortium partner for Liverpool's 5G health and social care testbed. The testbed was then built to connect health and social care services to people in their homes without them needing to have broadband in their home. So it fit in really nicely. The idea was then to try and bridge that digital divide, particularly choosing the area of Kensington and Fairfield in Liverpool, which is one of the most deprived areas in the country. Also has one of the lowest proportion of households that have home internet. But with this great need for health and social care services and a need to be able to provide those. So that if people are coming up with these new technological solutions for health and social care, it doesn't really help unless the person has an internet connection, because if they don't have an internet connection at home, they can't benefit from the technology that you're offering. So was there a way of using 5G to be able to run out internet connection to a big load of homes, be able to get services out there that could just be connected? So what we got to be able to do was develop the LoRaWAN version of the push-to-talk button, to be able to change that around from Ethernet, put LoRaWAN in there and give us that wireless connection. We got to deploy those with users in the testbed area, and we got to install LoRaWAN gateways to be able to cover that area, so that basically anywhere in that area you could go, you got LoRaWAN connection, you could put LoRaWAN devices out through the Things Network. I think that means that we were the first deployment of LoRaWAN gateways with 5G backhaul anywhere in the world, as far as I can tell. They're still up and online and running now. But the key bit there was it let us deploy buttons to a new group. In this case, it was adult carers, so people who care for another person in their home, unpaid, almost. So they're an unpaid group. So these people aren't necessarily physically isolated like the previous ones we've worked with, because they're able to leave. Often they have jobs, but because of their caring requirements at home and the care of the other person in their house or the other people in their house that they're looking after, often socially isolated from their peers, from people who understand them, even if they are able to see other people. So in this case, what Push-to-Talk does is let them talk to somebody who understands their situation, somebody who has something in common with them. Again, we were going through, it had to be a non-specialist deployment. We were deploying these buttons through carer support organisations. It's no good if I just turn up, knock on the door and say, "Hi, I'm from Push-to-Talk, I've got this button for you." It needs to be so that people are in their own homes receiving this service from the organisations that they normally interact with. So all we had to have to be able to deploy a button was the button identifier number. So on the bottom of the button, each one had a number on it. And then once the button was in somebody's home, the user or the person who was taking it out could ring us and give us the button number that they got in front of them and the phone number of the house, so we could link that up with what we were expecting. We would then basically call that back, check that everything was working, and from that point onwards, they were all set up. There's no apps, there's no phones, there's no specialist requirements. If they have the phone, that's all they need to be able to set this up, which was really nice, really, really neat for that. Feedback we got from the service was excellent. Lots of people really enjoyed it, had lots and lots of calls. Average was about 15 minutes of people talking to each other. I think the longest one was an hour and 42 minutes, was as far as we could tell, just a first one-off. They must have really hit it off, that one. But the group that we got was still relatively small. And for us, that was kind of the biggest hurdle there, getting enough people so that you have enough people pressing the button at the same time that the whole thing becomes sort of self-sustaining. To get around that, we did a robocall at a regular time in a day, but there's really only so many times you can robocall people in their home in an evening. So this is what that looks like as a system diagram. So you've got the button in these two people's houses, and when they press their button, you've got these LoRaWAN messages that are going up. They've got a local LoRaWAN gateway or gateways, and that's then passing the button information back via 5G in this case through the internet to the push-to-talk server, so we can initiate that phone call out to them between those two people who've just pressed. Now, the button itself, the button is dumb. I mean, it's an internet-connected button. All it does is send a message each time that it's pressed, plus some regular live messages, so we know sort of how many buttons are online, or if any have gone offline, or what signal strengths are, those kind of things. And with the push-to-talk buttons, they're not really a sensor, but they effectively are. They're kind of collecting information about that user, and specifically if that user is feeling lonely and wants to talk to somebody. We've effectively got a sort of a LoRaWAN loneliness sensor. But this kind of this loop round feels very different from quite a lot of LoRaWAN users. If you've got sensors that are out in the field, that are battery powered, that sat there for years, they're recording their data and they're forwarding it as they get it, and then the other end is collecting that and storing it to be able to act on later, or look back at, or make trends from, or decide. In this case, we're trying to keep as near real time as possible. We're using that action to trigger a response directly back to the point, back to the person where that button is. So we're kind of closing that loop up. But crucially, we've passed that sticking point. We have no internet connection for the user in the user's home being required. The buttons work wherever there's TTN, wherever there's LoRaWAN on the Things network. So push-to-talk was originally built to support those who didn't get much contact with others, like the elderly isolated, but suddenly this year there's a pandemic. And the UK government then released guidance that extremely vulnerable people should isolate at home for 12 weeks to reduce their risk of infection, what they're calling shielding. But for those people who are being asked to shield, that means 12 weeks without contact with others, 12 weeks without having people to talk to. For those people without access to digital communications, that means 12 weeks without a face-to-face conversation even. There's 12 weeks where they can't go out to the shops, they can't have anyone nip round for a chat. And for an idea of a scale of that problem, in the Liverpool City region alone, there's an estimated 50,000 people who are in that group. That's older people, that's people with medical conditions. So here's what we're doing. We currently have two options for the button. We have a mobile app that we built, and we have the LoRaWAN button from the 5G tests that we did. In terms of rollout, number of users, the mobile app is the button for most of those users. It means we can send an introductory SMS to a new user, they can download the app, they can log in, and then they're all sorted, they're ready, they're on. But if somebody doesn't have a support smartphone, or they don't have internet access, we've got a LoRaWAN button that we developed in the 5G trial that we can start to roll out to those people. So for that LoRaWAN button user, they don't even need to have their own internet access. As long as they're in range of a TTN gateway, you can plug the button in, phone us up, and everything just works. And LoRaWAN here really lets us fill in the gaps. It lets us make sure that no one gets left on their own, and they can still just press the button and talk to someone.